Hello everyone, I'm Dr. Emmanuel Winkana, and we at Venice Medicare want to wish you a happy World Health Day. As you are aware, this is an annual event organized by the World Health Organization, and the theme for this year is Healthy Beginnings, Hopeful Futures, which targets maternal and infant health. In other words, what we're talking about today is what are the things you need to do as a pregnant mom or as an infant, what you need to do for your child as an infant, as a baby, so that they could have optimal and adequate health Now, the WHO made us understand that there are about 300,000 maternal mortalities every year and about 2 million infant mortalities every year. This is very avoidable if we practice certain health tips or carry out certain health practices that will help us to avoid these deaths. Now, today we're just going to discuss about 11 tips on how you can ensure good maternal and infant health. And we're going to take it in two steps. First, from the maternal side during the pregnancy, and from the infant side as a baby. So the first thing we're going to talk about is your antenatal care. As a mother, once you're pregnant, it's advised to register for your antenatal care within the first 12 weeks or the first trimester of the pregnancy. The idea of this is so that you will get adequate follow-ups and monitoring by the doctors and the nurses at the hospital, so that they will monitor you closely and also detect any issue on time and arrest it as soon as possible. Another tip is we should ensure regular antenatal visits. So it's not just to register, you should also visit regularly. And when you visit, if you notice any issue, any health related issue, anything outside of the norm, or anything that is not ordinary you've noticed, please report it to your doctor so that they would treat and arrest the issue accordingly. And thirdly, or fourthly in this case, you should please take your antenatal medications as prescribed. And any other medication that might be given to you during your antenatal care, please take them as prescribed. So, assuming you have any comorbidity during your antenatal care, what we're talking about, maybe you have pregnancy-induced hypertension or gestational diabetes mellitus or whatsoever it may be, you should take whatever medications that are given to you regularly and as prescribed. Another tip is, please take advice from authorized medical personnel. Please avoid unsolicited advice. Avoid advice from people who are not medical personnel, so that you'll be getting the right information and you take the appropriate action for your health and for the health of your baby. Once you've given birth, ensure you breastfeed your baby within the first 24 hours. As some of you are aware, that is one of the best or the healthiest milk, so to speak, given to a baby, the colostrum, within the first 24 hours. So please give this to your baby. The reason is because it's rich it has some immune factors that help to protect your baby's health from sicknesses and ailments. It also helps your baby to grow well. It has some growth factors as well that help your baby to grow and develop well. Another tip we should be taking out today from here is, you should please ensure you wash your hands regularly, as well as anyone who comes around your baby. Please let them wash their hands regularly. Babies are little and their immune system are not as developed as the adults, so we have to be careful around them. Ensure that your hands and the hands of those around you are washed regularly before touching the baby as much as possible. This will reduce the risk of ailments and diseases. Another tip we should be looking at today is, ensure that you report any health issue you notice with your baby as soon as possible. Please do not try to self-medicate. Do not try to treat your baby on your own. Please report to the doctor as soon as possible so they can take care or arrest the issue as soon as possible. Also, attend your postnatal visits. They are not just there to waste your time. They are actually there to guide you and to advise you on how to take care of yourself and your baby and also for them to detect anything that might be wrong with you during the visits. Also, we should ensure that you practice good hygiene around yourself and your baby. You as well should eat well as much as possible. Eat well and rest well. If you don't eat well, you might not be able to give your baby enough breast milk. If you don't eat or rest well, you might not be able to give your baby enough breast milk. And when you're giving and one of the things we also want to talk about is ensure you practice exclusive breastfeeding. The reason for this is it has so many benefits, from a good immunity like we spoke about earlier on, and also good brain development for your child, and also good overall development of your child. So you need to eat well for you to have enough milk to give to your child. And what do we mean by exclusive breastfeeding for those who don't understand? What we mean is giving your child breast milk exclusively for 6 months without any other thing entering your baby's mouth except the medications prescribed by the doctors. You should give your baby only breast milk. And lastly, the last tip for today is please ensure your baby is immunized. The good thing about the country we are in is these immunizations are free up to, I think, 18 months or thereabout. So please ensure that you take your baby to the hospital and ensure that they are being given all the immunizations that they are due. And lastly, please just take care of yourself as much as possible and try to apply these tips. We believe if you apply these tips and more, you will be fine. And if you, for some reason, you go to the hospital and the doctor detects one ailment or the other, don't be discouraged, don't lose hope, either for you or for your child. Or maybe your child was born with one defect or the other, don't lose hope. Just make sure you carry out the instructions of the doctors and try to follow the guidance given to you, and you'll be just fine. I hope we've been able to give you some tips on how to take care of yourself and your baby in this period, whenever you're pregnant or whenever you give birth to your baby. Thank you for your time, and we'll hope to see you with Venus Medicare soon. We care about you.